Dr. Johnson, fibromyalgia is oftentimes referred to as the invisible illness. Can you explain what this illness is and why it's referred that way?
Yes. A lot of people all of a sudden develop pain just all over their body. It can affect their arms, their legs, their head. They ache. They're fatigued with it a lot of times. And most of the time they go to the doctor, can't find out what it is, and so then it's diagnosed as fibromyalgia. The diagnosis of fibromyalgia assumes that all other underlying causes have been ruled out, but many times that's not the case. Doctors will run some tests on you, like rheumatoid arthritis, an RA test, an ANA test for lupus, do a cedrate, a C-reactive protein, which looks at inflammation, make sure there's no infection, and then they say, well, we don't know what it is. You must have fibromyalgia. And they test the different points on your body for soreness. If you have 11 of 18 tender points, that was the old criteria then, you qualify as a fibromyalgia type patient. Here in my practice, though, we look at underlying causes further than just the screening blood test. So there's all kinds of things that can cause inflammation in your body. That can be food you're eating, things you're exposed to. They can be pesticides, chemicals, molds, which produce mold toxins from the black indoor molds. So all those type of things can and do cause joint pains, muscle pains and aches, fatigue, memory problems, and are necessary to look at to rule out underlying causes. The other areas are like infections, and some people live in tick areas where there's the deer tick, and they get bit by a tick, get a Herald spot, and then within a few days come down with joint pains and aches, fatigue, and that may be Lyme disease. Some people have chronic Epstein-Barr virus or mono, may be another underlying factor with it. In the summertime here in Texas, we have mosquitoes, and some of the mosquitoes are carriers of West Nile virus. You can get bit by a mosquito, have fatigue, joint pains and aches, and that virus affects the nervous system. So you can start to get disoriented, and then you get encephalitis or inflammation of the brain with it. So looking at some of these other areas and questioning exactly what is the cause really makes sense in defining why you feel bad.
Gotcha. So there's no specific cure for it, but there are ways that there are things you can do to improve yourself.
Yeah, well, fibromyalgia is that catch-all term. There isn't a fancy pill for it. There is a cure for it if you find out what the cause is, the underlying cause. And that's what we do here at Johnson Medical Associates. So all the items that I mentioned, whether it's an infectious agent, whether it's a toxic agent, whether it's a food source, or you've been exposed to something that flares you up, we look at all those different underlying causes, and then when you treat the cause, you cure the condition. It goes away. Now, if it's a sensitivity that's causing it, then you have to continue to avoid that for a period of time, get your immune system calmed down, and then you can reintroduce what you've been exposed to.
Okay. And is there any age group that's more prone to it, or gender or ethnicity?
Yeah, exactly. Women tend to have more fibromyalgia than men. Sometimes you see it in families. And if it occurs in families, then you start looking at underlying causes that affect the whole family. And typically, then that's either a pesticide that they applied in the home, or they have a home that's contaminated with mold that produces toxins. And so the whole family is exposed to this chemical. It's a neurotoxic chemical called mycotoxin that affects the energies in your body. So it affects the mitochondria, it affects your muscle cells, it affects the nerve cells, it affects your brain function, can affect your gastrointestinal system, and the whole family is sick. Many times I see patients that have seen other physicians, and sometimes they'll come in, let's say the whole family has Lyme disease, but they've never been bitten by a tick. The Lyme antibodies cross-react with mold antibodies, and you get false positive Lyme antibodies. So they may have antibody positive but not really have Lyme disease, where they actually have mold exposure. And you see this commonly in families that are sick, and they say, well, I felt pretty good until I moved into this new house, or it's a new house to us, but it's an old house and it smells a little funny and damp. And then the underlying cause of fibromyalgia in their illness is mold toxicity.
And someone who may be watching and think that they may have fibromyalgia, like and they come and see you, like how long will it about take for you to discover what the underlying cause may be?
Well, sometimes it's really quick. Just the history will tell us. Then a few tests could tell us, either a skin test to look at the allergy part of it, a urine test to look at toxicity, a blood test to help us look at toxicity or infectious disease type items. And we pretty well, in a week's period of time, it may take a week to get some of the tests back, determine what's going on.
Okay. And before we take off, can you give your website, your phone number, any way that we can get a hold of you if anyone has questions?
Most definitely. One additional point is once we define what it is that the person's been exposed to or what they have, then there is specific treatment for that. So if it's West Nile virus, there's treatment for West Nile virus beyond just waiting. I use high-dose vitamin C to help with the virus, and hyperbaric to help with the encephalitis, the brain part of it. If it's Lyme, there's direct treatment for Lyme. If it's toxins, there's direct treatment to help deal with the toxins. My website is johnsonmedicalassociates.com, or you can look at hyperbaric-centers-of-texas.com. The telephone number is 972-479-0400.
All right. Thank you, Dr. Johnson.